Memory loss. There's no such thing as just getting senile. Benign forgetfulness may be a part of normal aging, but when memory loss and confusion interfere with a person's ability to function independently, there's a problem.
There are basically four lobes of the brain, okay? There are the frontal lobes, okay, which are in the front. Then there is something called the parietal lobe, which is behind the frontal lobe, okay? There's the occipital lobe, which is all the way in the back. And then just sort of here at the bottom, under this line here, okay, which we call the Sylvian fissure, this is called the temporal lobe, okay? Most of the temporal lobe actually is deeper, but this is the sort of the superficial part of it that you're seeing here on the surface of the brain. Okay. Now, each of these areas has a distinct function, okay, and therefore is prone to dysfunction in patients with dementia. I just want to make a point that the term dementia simply describes a symptom complex that a patient has, which includes memory loss plus another cognitive dysfunction, another area of cognitive dysfunction that progresses over time and affects a patient's ability to function normally in either social or occupational circles. However, the dementia is simply that, a symptom complex, okay? What we really need to remember is that dementia is always caused by some underlying disease, okay? Be it Alzheimer's disease, which is the most common cause of dementia, or something called Lewy body dementia, which is the second most common cause in some studies. Multiple strokes can lead to dementia. Then there are less common causes of dementia, things like frontotemporal dementia and others. But dementia is a symptom complex which is always explained by a disease. So when a patient goes to see the doctor for dementia, the doctor's job is to try to figure out what disease is causing the dementia, okay? Whether it be some degenerative disease, some vascular disease, or perhaps even a metabolic or nutritional disorder or caused by medications. There's always some sort of cause that the doctor needs to investigate.
The cause is a dying brain. And a dying brain means that your files, your capacity, your experiences, your knowledge, away.
That memory store, it's like a computer.
We are
Essentially,
mechanical.
that memory store
Exactly.
is getting disabled, and you can no longer access those areas. I mean,
They're
it's the
gone.
plaques and tangles that you may have read about in some of the medical literature.
They go black and dead.
Yeah.
That's one of the most hurtful things to me.
Well, it's a sad state of
That
affairs.
loss,
Yes.
the artistic loss.
Yeah.
She was quite artistic.
How can you tell, who can tell, when it really starts? Initially, it's dementia, it's this, it's that. I mean, we think, so,
Yeah.
but is that the start of Alzheimer's? We don't know that.
We don't know.
So the
You guys have
time
probably
period-
seen the most.
Well, you get indications because their attitude and activities change.
Right. Yeah.
Was this in '99?
Yeah, well, that's how I got. I think I told you. I was looking in the closets one day, and I opened up the closet door, and there was 1,000 packages, 1,000 Brillo pads. You know.
Supply.
Now I'm not too neat, but she
This is
was.
This is 99
That's a lot of
years ago.
scrubbing. Yeah.
6.
6 years ago.
Now, when I saw that, I now said, "Wait a second," because this woman, like all our wives, are very efficient housekeepers and,
Yeah.
and wives and what have you.
Yeah.
And I watched her, and what would happen is she'd go shopping, and she would not remember that she had bought Brillo pads. Now, she was never big on Brillo pads, but here they come, right?
So that was a wake-up for you.
So as soon as I saw that, I took her to our local physician, and he gave her the basic test, you know, draw the clock and so forth. And from him, we went to the not internist, neurologist.
He
And that's how we
confirmed it?
began. But up until that, she could have been ill before I saw the
Yeah.
Brillo pads, but I don't think it would have been a long time before that.
Yeah, you see
that's what it is,
inconsistencies of behavior that start to go to extremes. The 1,000
Or just a
Brillo-
memory. How about the memory
Yeah,
loss?
or the repetitive questions. I mean, that's how it manifested with my uncle. At the holidays, when the family would get together, the repetitive questions, you know, you're sitting there, and at first you say, gee, Uncle Charlie asked that question 10 minutes ago. Then a little while later, it's 5 minutes, 2 minutes, and then it's like the 1 minute turnaround, and, you know, you give the... In fact, we conditioned the family, just go with the flow and, you know, give him the answer and hope he stops asking the question.
her life is immediate. I was telling my neighbor yesterday whose wife is dying next door. I said, you'll speak to her and she'll be a marvelous conversationalist, or at least a listener. Her reactions, her facial expressions. And she'll say goodbye and walk away from you, forgot not only what you said, what she said, and who you are, what you are.
But making friends means a retention, a memory.
Yeah.
This is where Jenny really lost out, because she'd always
Yeah.
loved people.
Yeah.
We started to see it in Maine when we were living there.
Mm.
And she'd meet people, and she'd really like certain women she's in a meeting or a group of some sort. And she'd tell me about her, or how wonderful she was. I said, what's her name? Did you get her phone number? So the friendship ends.
The disease is there, and the disease is talking. It's not the person that's talking, it's the disease. And if you understand the disease process, it makes it a little bit easier to understand where that person is coming from. It's very easy for me to say, like I know Al and Carol and I've known them for years, say, well, Al's just doing that to me because he likes getting back at me. I've known him all my life and he's just doing that. Well, no, Al now has a brain dysfunction going on, and he's unable to consciously think about what he's doing. So I have to get used to where Al is at and understand that new normal in my life, and understand also the disease process so that I can provide, as the caregiver, the interventions that are necessary. And also to understand when I need to step back and be able to say, I need some help here, I need some support, I need some time to regroup, because it's hitting you just as much as it's hitting them, but your whole life is changing as well. A diagnosis of Alzheimer's not only affects the person, but it affects all the caregivers, the entire family. So everyone gets Alzheimer's, not just the person.